Hello, this is New Vision TV and here's the latest news. I'm Lynn Komjisha. Not every person living with HIV will continue to access prophylaxis contrimazole to prevent opportunistic infections after the Health Ministry revised guidelines for the consumption of septrin. Dr. Joshua Musinguzi, the AIDS Control Program Manager at the Ministry, said the tablet will stay essential for new patients and children below 15 years. But for older patients who have achieved virus suppression and regained their immunity, the prophylaxis would no longer be part of their treatment regimen. Musinguzi said the decision was informed by a commissioned study which indicated that persons whose viral load is suppressed beyond detectable did not require the drug. The revelation was made at the Health Ministry, where officials addressed journalists on the status of HIV in the country. However, activists said the move to get some patients off a major drug in the HIV treatment was uncalled for and were unsure whether the government decision was not in response to septrin stockouts witnessed last year. Moving on, the Manifesto implementation unit from the Office of the President under the National Resistance Movement Party is carrying out an on-the-spot physical monitoring of different government projects in the 8 districts of Acholi sub-region. The unit, led by Willis Bashasha, the Manifesto implementation unit director, noted with great concern that projects are generated from the central government, do not engage local governments, and yet they are within their areas. Bashasha said when such projects are managed centrally, the level of quality output is affected due to insufficient monitoring and supervision. Bashasha, however, said this would not have been a problem if resident district commissioners were doing their work effectively as enshrined in their mandate. He equally said if RDCs, chief administrative officers, and the district chairpersons could unite instead of fighting personal wars, it would be easy to monitor such projects. And now, many health workers countrywide do not wash their hands before attending to patients, which results into the spread of diseases. According to Dr. Jackson Omone, the Commissioner in charge of Integrated Curative Services at the Health Ministry. Speaking at a stakeholders meeting recently, Omone noted there are healthcare-associated infections which are easily transferred from one person to another through touch. He also revealed that hospital-acquired infections are used to medicines in healthcare settings and become resistant to antibiotics. Therefore, cleaning hands using soap and water may not be effective. Ammonia advised health facilities to buy alcohol-based hand rub formulations, which World Health Organization recommend for infection control in a hospital. According to World Health Organization, healthcare providers might need to clean their hands as many as 100 times per 12-hour shift, depending on the number of patients. Ammonia added that for many health workers, the recommended times for washing hands is far below the expected. In sports news, Busoga College Mwiri took back the reins as the Boys Cricket Week champions on Friday after their 5-wicket victory over St. John High School Mukono at King's College, Budo. To say that Mwiri's top order started off their innings poorly would be an understatement. The ever-confident Perry Wazombe faced 4 balls, easily finding the boundary with 3 and his 4th. He succumbed to Zephaniah Adenator's bowling. 2 more wickets fell in the next 2 overs, and it all looked like doom and gloom for Mwiri, but a mature knock from Ramadan Ochimi steadied the ship. Ochimi scored 47 runs, 3 shy of 50, but his sharpness to the situation was why he stayed on the crease longer than his teammates. He was a stalwart as he chose to play smart cricket instead of going for the big shots at a time when Mukono was vaporizing Mwiri's top order. Trevor Bukenya's 25-run stand was vital in how the team managed to chase down the total as well. You're still watching New Vision TV, and now for Pearl of Africa series, we take a look at Itanda Falls. Itanda Falls are located in Jinja district along the River Nile. They are known as one of the most hidden jewels of Uganda because getting to where they are situated is not easy. However, the falls offer various activities like rafting, boat riding, sightseeing, among very many others, including a memorable vacation if you choose to take one. Let's take a look.
for those who are not immediate locals to find Itanda Falls, but when you reach here, the sight is unforgettable. This hidden treasure in the Pearl of Africa is located particularly in Jinja district along the River Nile. Just like rapid speed of water at the Nile, Itanda's water pushes through the rocks as it flows. Visitors who come to these falls engage in rafting, and the brave ones even swim, but the rocks are very slippery because of the moss that grows on them. The sharp rocks and the rocket-like current can trap even the most experienced. But now for more Pearl of Africa stories, visit our website www.newvision.co.ug. Our newspaper, The Sunday Vision, is also another home of adventures, so grab your copy every Sunday for Pearl of Africa stories.
And that's all we had for you. Thank you for watching. Be sure to catch more of your updates on your mobile, on your desktop, on your tablet, anywhere on the go by visiting www.newvision.co.ug. I am Lynn Komjisha.